Today I'm going to talk about the foot. And what am I going to talk about? This, the arches of the foot. Yes, yes, the arches of the foot. Why is it important? This is important to every one of us. You begin to wonder how have you been able to stand for so long, probably as an usher, as a soldier. Yes, because of the arches of the foot. They enable you to stand. It gives that support, that stability when you're standing for so long. And sometimes you've been able to jump from a staircase, and then it looks as if you have that shock absorber. It serves as shock absorber when you jump. And when you are running, it serves as this kind of springboard, transferring forces from the front anterior to the posterior. So you can see it serves many functions. As a matter of fact, when you want to join some kind of forces or the military or paramilitary, one of the things we'll check is to see how normal or abnormal your arches are. It's very important. But when you come across this, how do you discuss this? Very simple. Let me give you straight tips. Number one, know its location and its definition. So what is arches of the foot? Is that outline, that morphological, that structural outline of your foot when placed on the ground or when in the plantar position. When you place on, you see that outline, that curved outline, as if it looks as if it's not touching the ground. You can actually put a stick or pen under. That is the arch of the foot. Now, there are basically types. The next thing now, there are basically two major types: the longitudinal arch and the transverse arch. The longitudinal arch is further subdivided into two: the medial and the lateral. The transverse is further subdivided into two: the anterior and the posterior. Having known the definition, the location, and the type, the next thing, how are they formed? Because I'm talking with respect to the longitudinal arch for today. Now, the medial longitudinal arch is actually formed by one, the calcaneus, the major bone you call your heel. Two, your talus in front. And then, by the side, the navicular, the keystone bone of the medial longitudinal arc. And then supported by the cuneiform bones and three medial metatarsal bones. What about the lateral longitudinal arc? It's being formed by, again, the calcaneus, what we call the heel bone, supported by the cuboid, which is on the lateral, the major keystone bone, and the two lateral metatarsals. So you can see how they are formed. Number three, how are they maintained? To maintain that kind of outward curve. Number one are the ligaments. There are so many ligaments here. From the medial aspect, you have the calcaneonavicular ligament, very strong ligaments. On the lateral side, you even have the short ligaments. The spring ligaments are there that keeps it in shape. Two, you have the muscles. Yes, muscles surrounding those arches. And one of the muscles from the medial side, you see the adductor hallucis longus. You also see the flexor hallucis longus, the adductor hallucis muscle. And then see the flexor hallucis longus. On the lateral side, you also see the adductor digiti minimi, and then the flexor digitorum brevis on the lateral side. These are muscles around it. You also see the bones around those ends. The bones that forms in the joints also maintains it. That's talking about how are they maintained. Yes. And then the next thing you talk about is applied anatomy or clinical correlates. Number one is that sometimes some individuals may tend to have what is called an excessively curved arch, and that is called pes cavus. It will be so curved such that even a hand, a blow can pass on that, or somehow like that. That is pes cavus. It's excessively curved. And then sometimes you see some individuals in which the curve is so flat on the ground. In other words, they have a flat foot. Such persons cannot be taken into the military because it will affect their performance, which has to do with those functional significance I stated earlier in jumping, in standing, in running. These are sometimes you also see what is called a clubfoot, in which the medial aspect of the foot is excessively curved inward. This affects movements. These are some of the clinical correlates of the arches of the foot. So when next you are asked to talk about the arches of the food, know its outline, starting from